Hello, my name is Sean Sorrell. This is for my class for Mary Mosley, ENC 1101, and what I will be talking about is the usage of marijuana on cancer patients and the effects that have been happening over the recent years through studies. The current path that marijuana has been taking on cancer patients is around, I want to say now, 40%, growing stronger from last year's 18% over opioids and the painkillers that are prescribed usually throughout the passing of chemotherapy through on these cancer patients. Now, what cancer patients have been saying that marijuana does do a lot better effects of handling is the nausea from the chemotherapy that it causes. Marijuana has this more settling feeling, just allowing those, I guess, feelings that they would have afterwards of the nausea, and the radioactive effects would be more calming onto themselves, of allowing them to, have a better time with the experience and, the passing of this horrible disease that they now have. Continuing on with that point, chemotherapy also has an effect where these cancer patients are not hungry anymore. They choose to not eat over multiple reasons. Could be possible depression or loss of appetite. It's multiple reasonings behind it. And one of the side effects of marijuana is an increase of appetite. So it slowly has a more hankering for this development of wanting to go out and eating more any foods for this reason, which is a greater effect than many of the other opioids, with greatly increasing more of a depressive use. I know in a lot of the other drugs like hydrocodone and oxycodone. I know a lot of the other more codeine, definitely, tramadol, a lot of those other pills are very, very hurtful onto your body, very destructive of the liver. The only side effects of usage of marijuana that have been reported is after excess usage of the so-called drug. It allows for the person to feel a little more nauseous than they were before. It is a possibility throughout, having an overage of the THC in your collection system, throughout these cannabinoids in your bloodstream, and everything, mellowing out as well throughout this experience. But as we can see that throughout the cancer patients, this has been greatly increasing to a higher age group, going into the ages of, I want to say, about 24 to about 56 is around the ages that this age group has been experimenting more often to it, and that is the increase from the 13% previously talked about to now this 40% that we are seeing in the increase of usage compared to the opioids that were distributed at the beginning of chemotherapy.